Hi PSA members, in this week's President's Message, I wanted to update you on two things that are happening this week. First of all, this week I'm in Canberra attending the Department of Health and Aged Care's Primary Care Conference, flying the flag for pharmacists and our pharmacy profession. I must say the conference is a great opportunity as we position pharmacists to play an even bigger and a recognized role in primary care. Now, what really resonated with me was yesterday at the opening, the Department Secretary Blair Comley, in his opening address, he mentioned the 4 focus areas that the system would need moving forward to meet the aging population healthcare needs. First one, he focused on the need to pivot to prevention and early intervention. As we would all know and agree, pharmacists play a key role and we are often the first port of call when it comes to circumstances like that. And therefore, if the conversation was about pivoting and increasing investment into prevention and early intervention, there is no doubt at all that you can imagine that I would be absolutely flying the flag for pharmacists to make sure that we are not forgotten in that conversation. The second thing that he mentioned was health equity. And for those of you who have actually read our PSA's Pharmacists in 2030 document, you would know that we have a focus or an emphasis on health equity about what pharmacists can do and should do to enable Australians to have equitable access to healthcare. The third area that he mentioned was on health technology. Again, we've repeatedly mentioned that there needs to be, again, pharmacists and pharmacies should not be forgotten when it comes to enabling digital health. But again, we must not be forgotten in that conversation, and there's a lot of alignment in that regard. And the last one is in relation to system integration. And of course, we all know in our profession, we know that there have been challenges and frustrations when the systems that we use don't always integrate. So absolutely, the system is not perfect and there are a lot of room for improvement. And it's the sort of conversation that we need to continue to have to make sure that we can clearly outline and clearly articulate what the needs are of our profession for us to actually be able to do our job. I've repeatedly in the past mentioned that yes, pharmacists can and should do more to contribute to a stronger and a strengthened healthcare system. However, we cannot do more without support. And these sorts of conversations are so important because we understand, we are pharmacists, we understand pharmacists, and it's up to us to be representing pharmacists, to put forward things that are pertinent to ourselves and to ensure that we are not forgotten. It's obviously a journey, and I've repeatedly said that amid health system challenges and the aging population, pharmacists are the solution to a stronger primary care. It is a journey and we're absolutely not slowing down there. This week is also Women's Health Week. And the theme this year is Your Voice, Your Choice. This is so important because it's a strong reminder about the importance of women's health, but importantly about what us as healthcare professionals, pharmacists, what we can do to actually help to encourage open and safe conversations with women about their healthcare. I want to do a special shout out to the great work of Jean Hills and their organization and the resources and the leadership that they have provided. There is a link to their website in the description below, and I would encourage that you check out the resources that they have and also how to get involved with hosting an event this week at Women's Health Week. PSA, we are a member on the National Women's Health Council and a co-chair to the Subcommittee on Access, Care and Outcomes. PSA is again flying the flag to raise the profile of pharmacists, but also importantly, looking at how women's healthcare can be improved across the board in our healthcare system. This is a journey, but I do encourage that you take the opportunity this week during the Women's Health Week to have conversations with people around you, with the people that you see in your work to encourage women's health. Also later in the week, I'll be heading to Sydney attending the Pharmacy Connect conference. So I hope to see some of you there.